Hello, my name is Mayo. So I am demonstrating the nasal gastric tube insertion today. I have verified the physician's order for the NG tube insertion for suctioning, and I have all my supplies. I have a towel, piston syringe, an NG tube. I have water-soluble lubricant, some tape, a pen light, and then our MSS basin and a pH test strip and a specimen cup and a cup with water and then gloves, basin, a container with warm water. Next, I'm going to gather everything, enter the patient's room, close the door for privacy, introduce myself to the patient. Hello, my name is May. I'm going to be your nurse today. Can you verify your name and date of birth? Thank you. So, Mr. Smith, the doctor has ordered a nasal gastric tube insertion for you today for suctioning. The tube will suction the stomach content, which will help relieve your stomach discomfort that you have been experiencing, like nausea, vomiting, and bloating. Gonna perform hand hygiene, put on gloves. I know it sounds a little bit scary, but we'll get it, walk you through step by step and we'll get it done smoothly. Okay, do you have any questions? All right, I'm gonna place the bed in a comfortable working height and a patient in a high Fowler position. Um, Next, I'm gonna inspect the patient's nair with shining the light inside. Mr. Smith, please tilt your head back a little bit. Okay, so I'm inspecting see if any swelling, abrasion, uh, blockage, or deformity inside the nostrils. Next, Mr. Smith, I'm going to have you cover your left nostril and breathe in and out with the right nostril. Okay, and then we're going to do the same with the right nostril. Cover the right side and breathe in and out with your left nostril. Very good. I see the left nostril have better airflow. We're going to insert the tube there on the left nostril there. Next, I'm going to measure the length. So we're going to start from the tip of the nose, go to the tip of the earlobe, and then from the earlobe, we're going to go down to the xiphoid process. So I get 50 centimeter. I'm going to mark that with a piece of tape. I'm going to put the tubing inside the container that has warm water. I'm going to place the towel across the patient's chest. All right. I have my water-soluble lubricant. I got my nasal NG tube. Loop the tip of the tubing. Okay. Mr. Smith, I'm going to have you tilt your head back. I'm going to insert the tip of the tubing. Deep breath. All right, very good. If I meet any resistance, I'm going to withdraw the tubing and then we'll try on the other nostril. So I'm going to go insert and go along the nasal passage towards the left ear, toward the oral pharynx. And once I reach the back of the throat or oral pharynx, the patient may gag. I would offer him some sip of water, and then I'll also have the patient tilt his head forward. And as the patient swallow, I will insert the tubing 2 to 4 inches each time he swallows. Okay, very good. Swallow. All right. Swallow, swallow, swallow. All right. So we met the 50 centimeter centimeter mark. We're gonna stop there. Next, I'm gonna grab my piston syringe, and we will verify the placement by aspirating. We're gonna withdraw some stomach content. Okay, place the stomach content in the specimen cup and put the pH test strip in. And then the pH should be between 1 to 5, which indicates that the tubing is placed in the stomach. And also, we're gonna do the final placement confirmation by getting an X-ray. If we have any signs that indicate the placement of tubing in the wrong place, then we will either fix it or either we're trying to place in the right place, or we will take out the tubing and we'll restart the procedure. All right, so we have the right placement of the tubing. Next, I am gonna secure the tube tape with the tape. So place the tape on the nose bridge and then wrap it around. Okay, and then I'm gonna secure the tubing on the patient's gown, either with the safety pin or if not, then we can use a tape. And with the end of the tubing, we're gonna connect it to the suction source, and as the doctor prescribed, and then for the ongoing care of the NG2, we want to make sure it's patent and suction is working properly. We want to check for the drainage amount, the color, consistency, and also the rate of the suctioning. Next, I'm going to remove my gloves, perform hand hygiene, place the patient in a comfortable position, lower the bed in the lower position, lock it, and then discard all my used supplies in the garbage. Also, I will document the procedure, including the patient's response to the procedure. If any drainage came out from the tubing, I also document that, and all the assessment I did during the procedure. Also, the length was inserted, which is 50 centimeter in this for this patient. So I do all the documentation, perform hand hygiene, and place a call light for the patient within reach. All right, exit the room.